A cancer diagnosis it's just devastating. But what if the cost of treatment was just as crushing? Well, today we're looking at something pretty amazing happening in Nigeria. It's a groundbreaking partnership that's totally rewriting the script on cancer care, making these life-saving treatments actually affordable and accessible. So, let's dive right in.
All right, so here's what we're going to cover. First, we'll get a real sense of the problem. Just how expensive is cancer care in Nigeria? Then, we'll meet the folks behind this new partnership. After that, we'll get into the nitty-gritty of how their cost-sharing model actually works. We'll also see how they're taking this thing nationwide and wrap it all up by looking at the bigger picture, Nigeria's big push for health coverage for everyone.
Okay, so first things first, let's really set the scene here. We have to understand that in Nigeria, the cost of a cancer diagnosis, well, it's not just a hurdle. For way too many people, it's like hitting a brick wall. A wall with absolutely devastating consequences for patients and, their entire families.
And this quote, wow, it just hits you right in the gut. It's from Mr. Tersir Sar at Roche, Nigeria, and it really paints a bleak picture. He's saying people have to sell their property, borrow money, or just give up on treatment altogether. I mean, can you imagine that? Having to make that choice between your own health and your family's financial survival? That's the impossible situation so many are in. And that's exactly why a cancer diagnosis has often felt like a death sentence, not because of the disease itself, but because of the price tag.
But that story is starting to change, and this is where things get really hopeful. Let's talk about the solution. There's this powerful new partnership, a team-up between two major players. Nigeria's National Health Insurance Authority, we'll call them the NHIA, and the pharma company Roche. They've come together to create an initiative that tackles this crisis head-on. And their goals? They're crystal clear. This isn't just about, shaving a little bit off the price. No, this is fundamental. They want to tear down those financial barriers, open up access to modern cancer care, and, of course, help people get better. But the really crucial part is this. They want to protect families from those absolutely catastrophic costs that can just ruin them financially.
Okay, so we've got the who and the why. Now for the really important part, the how. How does this whole thing actually make a difference for a patient's bank account? Let's break down this new payment model.
And this is the question, right? This is what it all comes down to. How does this program actually save money for a real person who's going through treatment? What does it look like in practice?
Well, here's the answer, and it is pretty amazing. So if you're a patient with a national health insurance plan, the cost gets split up. Roche, the drug company, they cover a whopping 50%. Then the NHIA, the insurance authority, picks up another 30%. You do the math. That leaves just 20% for the patient to pay. That's an 80% subsidy. That's not just a discount, that's a total game changer.
Now, what about folks who aren't insured yet? And this is a really key detail, they haven't been left out. Uninsured patients can still get help. Roche will still cover 50% of their medication cost, which is huge. But as you can see, there's a massive incentive to get insured. Paying 20% versus 50%, that's a world of difference.
But the story doesn't stop there. We've got to listen to the people on the front lines. This quote from Dr. Suleiman Ulaide, a head of surgery, gives us that crucial boots-on-the-ground perspective. He thinks the initiative is great, but he's saying that for some people, even that 20% is just too much. He's pleading with the NHIA to bring it down to 10 or even 5%. It just goes to show you, the push is always on to make this care as accessible as humanly possible.
And that plea for more access is exactly why this next part is so important. You see, this isn't some small localized experiment. Nope, the NHIA and Roche are rolling this solution out across the entire country.
Just look at this number, 24. Right now, 24 different hospitals and clinics across Nigeria are already on board with this initiative. That's not a small number. It shows a real, serious commitment to making this a nationwide program. Of course, the challenge is always going to be to grow that number even more.
And you can really see the program's footprint when you look at some of the hospitals involved. We're talking about major teaching hospitals from all over the country. You've got Lagos and Port Harcourt down in the south, Ilorin in the middle, and all the way up to Kano and Maiduguri in the north. So this isn't just an Abuja or Lagos thing, it's truly a geographically diverse network.
Okay, so now let's zoom out for a second. This whole cancer initiative, as amazing as it is, doesn't exist in a bubble. It's actually a really important piece of a much bigger puzzle, Nigeria's massive push to get universal health coverage for every single citizen.
And the backbone of this whole movement? It's a law called the NHIA Act of 2022. And this thing is a BFD. It completely changed the old insurance system. And here's the most important part. It made health insurance mandatory for every single person living in Nigeria. The goal is simple, but super ambitious. Health coverage and fairness for everybody. And that law just got some serious teeth. Not too long ago, President Tinubu put out a directive basically saying, okay, it's go time. He ordered the mandatory implementation of health insurance across every single government agency. That's a huge signal, a clear top-down commitment that says, we are making this happen.
So you're probably wondering, okay, but how do they actually enforce a law like that? Well, they're doing it in a few really clever ways. First, all government workers have to be signed up, no exceptions. Second, and this one is a real game changer, if you're a company and you want a government contract, you got to show proof of insurance. And third, it's the same deal for getting certain licenses and permits. They're literally weaving health insurance into the fabric of how business gets done in Nigeria.
All right, so let's put it all together. You've got this amazing partnership tackling one of the most expensive diseases out there. At the exact same time, you have a new law making health insurance mandatory for everyone, and the government is seriously pushing to make it stick. It all leads to one massive question, doesn't it? Are we watching a real, honest-to-goodness turning point for healthcare in Nigeria?